leaders say our hospitals are getting overwhelmed. Some are starting to move patients to other locations and canceling elective surgeries. Hospitals are begging people to follow the basic health guidelines, like, of course, wearing a mask.
They pointed out the virus is not spreading inside hospitals, where masks are constantly worn and hand hygiene always prioritized. Fox 59's Courtney Crown has this word from people fighting the pandemic on the front lines.
Can you tell me, what is it like inside the hospitals right now?
Right now, the hospitals are extremely busy.
We're still managing. We're still able to handle any patient that comes our way. But it's certainly to the point of making us wonder what comes next.
Doctors, nurses, and medical staff in hospitals can tell you exactly why you need to mask up.
Right now, we can handle it, but if it doubles again, all bets are off, which is why we really need to make a change and make sure that we don't let this spread any farther.
IU Health has room at Methodist and University hospitals, but they are looking at places to convert into more space for patient care. Along with Riverview Health, they have enough masks, gloves, and supplies right now. They know the basics work.
I think what's really important to note is that, we are not seeing spread of COVID within the hospital, meaning if you follow the proper guidelines, you don't get it. You don't transmit it.
Doing one simple thing can make the difference between having to shut down the state again and not. And if you wear your mask, it's going to come out a whole lot better than if you don't.
During the governor's news conference, Dr. Christina Box, Indiana State Health Commissioner, gave us a snapshot of what is happening in hospitals across the state.
We're also seeing individuals changing different parts of their hospital to allow for additional medical surgical beds or add additional ICU beds. We are seeing hospitals work together within a region to be able to transfer patients or to alternate who takes the next critical patient that is picked up by EMS.
The good news is medical professionals know more now than they did in the spring.
We know now that we need to put people on blood thinners. We had no idea in the spring. There were literally rumors being passed from doctor to doctor about, hey, you might want to think about this because I knew this guy that had a blood clot. Now we know it causes blood clots.
So we're seeing more positivity in the community. From a hospitalized patient perspective, the positive side is we're not seeing as many patients with COVID positive diagnoses that are in the ICU.
Courtney Crown, Fox 59 News.
Now, it is important to note tonight, while the spread is high, doctors do tell us they do know better how to treat the virus, and more people are recovering. So that, in part, is encouraging. Until, though, there is a vaccine or widespread treatment, of course, healthcare officials say our best line of defense to control this spread is the basic protocols. That's masks, social distancing, and hand washing. Lindsay?